Last week, one of my patients climbed 3 flights of stairs without stopping. Doesn't sound impressive, does it? Except 3 months ago, she couldn't walk from her living room to her kitchen without having to sit down and rest, and she didn't do a single exercise to achieve it. Hello, I'm Dr. Akio Matsumoto. I've been treating knees for over 40 years, and what I'm about to reveal today goes against everything you've probably been told. Most doctors will tell you, you need to strengthen your legs, do these exercises, go to physical therapy. And you try, you push yourself, and it hurts more. But nobody tells you the uncomfortable truth. When your knees are inflamed and full of fluid, exercise is the worst thing you can do. It's like trying to put out a fire by throwing more fire on it. And yet, that's exactly what most people are doing every day, forcing themselves to do exercises that make the problem worse. But there's something different, something that comes from the mountains of Japan, where elderly people climb up and down steep slopes without knee pain. It's not exercise, it's not pills, it's not surgery. It's a 4-minute technique that combines specific heat with pressure on exact points. And when done correctly, it drains the trapped fluid, reduces inflammation, and restores movement. No forcing, no pain, no exercises. 3 months ago, a woman came into my office, Mrs. Keiko, 70 years old. She was walking with a cane. She told me her knees were so swollen she couldn't bend them completely. She'd been to 4 different specialists. They all told her the same thing. You need to strengthen your legs. Here's an exercise routine. She tried. Every exercise caused her more pain, more swelling, more frustration. When she came to me, she was on the verge of accepting knee replacement surgery. At 70 years old, I told her, Keiko-san, your knees don't need exercise. They need drainage. She looked at me confused. Drainage? Yes, I said. Your knees are full of inflammatory fluid. It's like having a soaked sponge. Until you drain that fluid, nothing will improve, and exercise only squeezes more fluid inside. I taught her this 4-minute technique. I showed her once. She did it with me in the office. And when we finished, she stood up, bent her knees, and looked at me with tears in her eyes. Doctor, it doesn't hurt. Why doesn't it hurt? 3 months later, she climbed 3 flights of stairs, without a cane, without pain, without surgery, and all because she learned to drain her knees correctly. Today, I want you to hear her complete story because I know many of you have knees that hurt, that are swollen, that don't respond to anything. And you've probably been told to do exercises that only make things worse. After you hear her, I'm going to teach you exactly this heat and pressure technique. The exact points, the exact timing, everything. If you have knee pain, if you feel like your knees are locked, if you've been told you need surgery, stay with me, because what you're about to learn in the next few minutes could save you years of pain and thousands of dollars in treatments that don't work. I have Mrs. Keiko waiting. She wants to tell you personally what she experienced. Let me call her.
Hello, Dr. Matsumoto. I'm here.
Good morning, Keiko. Thank you so much for speaking with everyone today. There are people who really need to hear your story.
Of course, Dr. Hello, everyone. My name is Keiko. I'm 70 years old. And if you're listening to this because your knees are ruining your life, I was exactly there, and I thought there was no way out. Let me tell you how bad it was just 3 months ago. My knees? Oh, my knees. They were so swollen that when I looked at myself in the mirror, I almost didn't recognize my legs. I couldn't bend them completely. If I tried to squat down, a sharp pain stopped me halfway. Climbing stairs was impossible. I had to go step by step, holding onto the railing, dragging one leg after the other. And the pain was constant. It wasn't just when I walked. It was all the time. Sitting, standing, lying down. Always there. That deep, throbbing pain. But you know what was the worst part? That I had done everything they told me to do. I went to my family doctor. He sent me to an orthopedist. The orthopedist sent me to a physical therapist. The physical therapist gave me an exercise routine: squats, leg lifts, stretches. I swear I tried. I forced myself to do those exercises every day for 2 months, and they got worse. My knees swelled more. The pain intensified. There were days I couldn't even walk. I went back to the orthopedist. They did MRs. They told me there's a lot of fluid. Degenerative arthritis. You'll probably need knee replacement eventually. Meanwhile, keep doing the exercises and take these anti-inflammatories. You don't know what it feels like to be told that at 70. Knee replacement, major surgery, months of recovery risks, and not even a guarantee it would work. I got depressed. I stopped going out. I couldn't go to my children's houses because they had stairs. I couldn't go to the supermarket because walking killed me. I started using a cane. My husband looked at me with sadness. My children were worried. And me. I was resigning myself to living like this for the rest of my life. Then my daughter found Dr. Matsumoto. She begged me to go. I didn't want to. I'd already seen so many doctors. What difference would one more make? But she insisted. And I went.
And what happened when I examined you, Keiko?
You touched my knees. You pressed gently on certain points. And you told me something no other doctor had told me. Keiko-san, your knees are full of inflammatory fluid. That's why you can't bend them. That's why they hurt so much. And every time you exercise, you're forcing that fluid deeper into the joint. I didn't know that. Nobody had explained it to me like that. Everyone said arthritis, but nobody explained what was happening exactly. The doctor explained that my knees were like sponges soaked with water, and that until I drained that fluid, nothing would work. Not exercises, not medications. And then he told me, you don't need surgery. You need to learn to drain your knees correctly. He taught me this technique: heat on specific points, pressure on other points in a specific order. He showed me exactly where, exactly how long. I did it right there with him. It took 4 minutes. 4 minutes. And when I finished and stood up, something had changed. I bent my knees, and the range of motion was greater. The pain had decreased. Not disappeared, but definitely less. The doctor told me do it twice a day, morning and night. For 2 weeks, you'll see the difference. The first few days were interesting. I felt weird things like something was moving inside my knees. The doctor had told me that was normal, that it was the fluid draining. The first week, the swelling started to go down. I could see the difference visually. My knees looked more normal. The second week, the pain had decreased significantly. I could walk around the house without my cane. After a month, I climbed 1 flight of stairs without stopping. I cried. My husband cried too. After 2 months, I walked for 20 minutes without stopping. I went to the supermarket alone. I visited my children, and now, 3 months later, last week I climbed 3 flights of stairs in my daughter's building. 3 flights, without stopping. Without pain. My family couldn't believe it. I couldn't believe it either. And all because I learned this 4-minute technique. I didn't have surgery. I didn't take stronger medications. I didn't do painful exercises. I just drained my knees correctly. That was it. If you have swollen knees, if the pain is constant, if you've been told you need surgery or that there's nothing more to do, please listen to the doctor. Because I was there, resigned, accepting that my life was going to be limited and painful. But it doesn't have to be like that. There is a solution, and it's much simpler than you think. If I could recover my knees at 70 after months of pain and failures, you can too. I promise you.
Thank you, Keiko. Your transformation is the reason I keep doing this every day.
Thank you, doctor, for not giving up on me, for teaching me something no other doctor knew.
What happened to Keiko is exactly what happens to millions of older adults with knee pain. And the problem isn't their knees. The problem is that nobody taught them how knees really work. Let me explain something that will change how you see your own body. When your knee becomes inflamed, it produces excess synovial fluid. It's the body's natural response to protect the joint. But that fluid has nowhere to go. It gets trapped. And the more it accumulates, the more pressure it creates. That pressure stretches the ligaments, compresses the nerves, and causes that deep, constant pain. It's like having an inflated balloon inside your knee. The more inflated, the more it hurts. And here's the problem. Exercise increases the production of that fluid. Every time you bend, stretch, or put weight on an inflamed knee, you're creating more fluid. You're inflating the balloon more. That's why the exercises they give you don't work. It's not that they're bad exercises. It's that your knee needs to be drained first before it can be strengthened. In Japan, in the mountain regions, elderly people have used a specific technique for generations. They combine localized heat with pressure on lymphatic drainage points around the knee. The heat dilates the vessels. The pressure guides the fluid out of the joint and into the lymphatic system, where it can be eliminated naturally. It's like squeezing a sponge correctly. With the right technique, the water comes out. Without technique, you just compress it and the water stays inside. Now, let me teach you exactly how to do this. This is the 4-minute heat and pressure technique for knees. Step 1. Preparation with localized heat, 1 minute. Sit comfortably. You need a warm towel or heating pad, not boiling, just warm to the touch. Place the heat on 3 specific points around your knee, just above the kneecap, the front of the bone, on the sides of the kneecap, left and right, just below the kneecap. Keep the heat on each point for 20 seconds. Rotate through them. Why it works. Heat dilates the blood and lymphatic vessels around the knee. You're opening the gates so the fluid can move. Step 2. Pressure on upper drainage points. 1 minute. With your fingers, index and middle together, you're going to press firmly on these points. Point 1, 4 inches above the kneecap in the center of the thigh. Press down and outward, like pushing something to the sides. 10 seconds. Point 2, on the sides of the thigh at the same height. Press and slide upward, 10 seconds each side. Repeat this circuit 3 times. Why it works, you're pushing the fluid upward toward the lymph nodes in the thigh. It's like opening the pathway for the fluid to exit the knee. Step 3. Direct knee drainage, 1.5 minutes. Now place your hands on the sides of the kneecap, one hand on each side as if you were going to grab the knee. With firm but not painful pressure, push upward as if you wanted to push the kneecap toward the thigh. Hold 5 seconds. Release. Repeat 10 times. Why it works. You're literally squeezing the fluid out of the knee capsule upward, where you already opened the drainage pathway. Step 4. Integration movement, 30 seconds. Finally, with the knee still warm, make gentle movements. Bend the knee slowly 5 times, without forcing. Rotate the foot in circles 5 times in each direction. Why it works. Gentle movement after drainage helps distribute the healthy synovial fluid that remains and prevents it from accumulating again. That's it. 4 minutes, twice a day, once in the morning, once at night. After doing it, you'll feel your knees lighter. Range of motion will improve. And with each passing day, the swelling will go down more. Now, something crucial. The first few days, you might feel weird things. You might feel like something is moving inside the knee. You might feel more fluid or more warmth. That's normal. It's the fluid draining. Don't be alarmed. It's a sign that it's working. Look, the reality is this. Knees with trapped fluid don't improve on their own. The fluid doesn't leave on its own. It accumulates more and more until the damage is so severe you need surgery. But if you drain correctly, if you give your body the opportunity to eliminate that fluid, your knees can recover, like Keiko, like hundreds of my patients. And once the fluid drains and the inflammation goes down, then you can start strengthening. Then the exercises work. But first you have to drain. That's the secret nobody tells you. Your knees don't need surgery. They don't need more pills. They need to be drained. Give them that opportunity and you'll see the difference. See you in the next episode.